Okay. I am going to go ahead and share my screen and then make sure you can still hear me. I'll just do the normal routine. We're going to get back to our non-holiday tempo on surveillance reports. And so it's Friday. You've seen data on Monday and you saw data yesterday at the Board of Health. So there's probably not going to be a lot that's, super different from what you've seen recently, but we do want to get back into the mix of things here. So hold tight. You still hear me okay? Okay. So this was just posted to the website a couple of minutes ago. Again, we did a pretty comprehensive report at the Board of Health meeting yesterday, and we also put out a report on Monday. But we're getting back to our normal tempo. We're seeing, not surprising, we saw a pretty distinct drop in both testing levels and the number of cases reported through the holidays for a variety of reasons. I think that partly has to do with people tending not to get tested, not to go to the doctor unless they absolutely have to during the holidays. And then we had some significant number of clinics, and testing capacity went down because people were off during the holidays, which is a good thing. But we've seen a rebound in the number of cases, but that hasn't been a straight up line. It's been and so we're going to continue to watch that, getting through the holidays, continue to see where we're headed. Our 7-day rolling average of daily cases per 100,000 was just over 65 cases. That's an increase of 13% from the last time we reported to you. Our percent positive, you can see, is now still above 10%, but it seems to have stabilized a little bit in the 7-day rolling average. We'd like, as we like that to be certainly below 10%. Once you get above 10%, you get in that territory where the public health guidance is that you probably are seeing some level of uncontrolled spread, and you're not detecting some cases that are out there. We dip below 10%. We really want it to be below 5% is ideal. We're currently, the 7-day rolling average looks like it was at 11.3% on the 5th. That's a bit of a decrease from where we were earlier in the week. But you can see the trend line there, and you can see how wildly that fluctuates from one day to the next, which is why that 7-day rolling average is really important to watch. These next slides are a little bit outdated. The state system, the MIDAS system that we use to populate these, has been down, which is part of the reason this was late being posted to the website. So this data here is not different from what you've seen earlier in the week. I will say we have not noticed a difference here. I don't think there's anything that I would not have expected this to change dramatically in terms of the number of the median number of days from specimen collection to report to public health. But I just want to make you aware that this data is a little bit dated, and that's just related to some hiccups in the state system that we tap into to get that data. We continue to use all the resources we have to pursue contact tracing investigations, and that really is changing from day to day based on the number of cases we have, the number of contact tracers we have, how in depth we can go in those interviews, and getting people in isolation and quarantine. That uptick that we've seen where the average number of cases is coming up to 65, that's getting to the territory where it becomes somewhat more difficult to do thorough contact tracing. We're continuing to get to cases. We're continuing to, as always, look for the most urgent and risk-laden exposures that those folks had. But when we start getting up, much above this, it becomes more challenging to do some of those more thorough contact tracing investigations, especially in light of the fact that we're also working hard to get vaccine distributed in a really timely way. You can see our onset date curve continues to kind of trend downward. That's good. Now there's some holiday stuff in there that we need to take into account. This is really when people who we're identifying a case, because the number of cases has come down, you would expect the reports of onset dates to also come down during those days. That this is probably a truer indication of when people were actually getting the disease and when people were sick than the day that the cases were reported. So that's why we track this. And again, this yellow shaded area is incomplete data because we haven't yet finished the contact tracing to populate that. Age breakdown, we're seeing a pretty significant steep incline in a couple of age categories. Between 20 and 40 years old, you can see there visually, but you know, continuing to track that as we move through the beginning of the new year. And then we kind of reset our MSU data. We're going to keep the fall data on there in summary form and starting to look at where we are with the spring semester. And so this is the first week of the spring semester, and we'll be reporting it that way. You can see we've got a significant number of schools that are managing active cases. I would say we also have a significant number of long-term care facilities. I think when I looked this morning, we were at probably 6 or 8 long-term care facilities, including some that had multiple cases. So we're still managing that. We don't have here today the hospital data for you. What I can tell you on that, when I talked to them this morning, still hear me? When I talked to them this morning, they were at they had, well, let me look at it here, make sure I get the number right. So, you know, in the critical care unit, they have 20 beds. They were all occupied this morning when we checked in, but only 3 of them were occupied by COVID positive patients. The medical, the med surge, they were pretty full there too. They had 3 beds. That interesting part of that is it's not really being driven by COVID. We've got, it looks like about, as of this morning in the census report I'm looking at, 12 COVID positive patients in the hospital this morning. That's not really a huge number compared to what we had seen in November. And it's not influenza either. It's just the time of year when they tend to get more people coming into the hospital. They're not overly concerned about it. That ebbs and flows. What I would say is it is a reminder though, that this time of year we tend to see higher numbers in the hospital regardless of a pandemic. With a pandemic, if we do see a higher number of COVID related cases, and then if we get influenza cases on top of that, that becomes more of a concern. We're not there yet. I'm not pulling any alarm bells. And, you know, they do have some capacity there. It's not like if they have to start diverting people or anything like that. They have some flexibility in how they're managing their patient load, but they've got a pretty full patient load right now. I would say that they're expecting to discharge some people, and that's normal. And it's also good that we don't have a high number of COVID patients in there. But I think just looking forward, we need to be cognizant of the fact that, you know, hospitals this time of year start to become under significant pressure, even when we're not in a pandemic, even when we don't have influenza season. So we want to keep that in mind. And that's part of the reason we want to be pretty careful about how we're managing the pandemic, and we want people to continue to do that social distancing to help limit the spread in the community. If we can reduce the overall number of cases, we know that that leads to lower numbers of hospitalizations, and we know that that leads to lower numbers of deaths. So that is that report is now on the website. You can access it yourself, and I'm happy to take some questions. And Whitney, do I need to? Is there anybody else on here that I need to call out? Oh, Mike and Patrick I see over there. Anything you guys want to add to that?
I don't think so. We're just here to stand by for questions.
Yeah, I guess I should also get into we're the third of our 3 pods for the week is ongoing at the fairgrounds today. We're continuing to refine that process. The community team that we have working on that, which I've said to you before, really involves much more than just the health department. It includes emergency management, Bozeman Fire Department, Highlight Fire Department. Fort Ellis is helping us with some things. Bozeman Health is helping us with it. We continue to refine that process, and we're continuing to try and get more and more people through that. We're hoping, we think we're going to get another vaccine allocation next week, which will allow us to do some more vaccine administration. Again, we'll continue to be in that 1A phase next week, which is those frontline healthcare workers. We're hoping to get that, get toward the end of that sometime next week and be ready to move into the next phase when the state is ready to do that. And I'm sure you'll have questions about vaccine allocation. We're going to continue to meet with our stakeholders group. The one thing overall I would say is, we're looking at where we are with the governor's new vaccine allocation plan. We went from 90,000 people who were eligible to probably about 250,000 people who would be eligible within the new 1B. To put that into some context, the state is currently able to distribute right around 6,000 or 7,000 doses to local health departments every week. So we're expecting to see that. They are expecting to see that jump as we move out of the long-term care facility distribution, because we've gotten those folks vaccinated. We're hearing that statewide allocation will go to probably about 13,000, but you can kind of put in context, with 250,000 people eligible in 1B and an allocation between 6,000 and 13,000, you can see we don't have enough vaccine to go around. And so we really need people to understand that this is going to be a long process. This is going to take some time. And there's no right or wrong answers to this. Everybody is working in good faith to make difficult decisions, and there's trade-offs to those decisions. In Gallatin County, I looked, we have, according to the recent census data, we have, right around 15,000 people who are 65 and older. And the allocation that we're getting on a weekly basis is somewhere between 500 and 1,000 at the health department. You can kind of do the math where this is going to be a process, and it's nobody's fault. It's just the fact that we have a limited amount of vaccine out there. It is pretty remarkable, and I think we should continue to acknowledge that we're about a year into this pandemic, and we have a vaccine, we have a safe and really effective vaccine available. The fact that we can't vaccinate everybody at once shouldn't be a major surprise, but I know it's going to cause confusion and it's going to cause some stress. And we just I need everybody to understand we are on what we can control is the amount of vaccine that we're able to distribute here locally. And when we get it in, to be able to distribute it, and we're working hard to build that machine so that when we do get vaccine in, we can get it out. We're also working on systems to make sure that when we do that, we're seeking community input. And when we're making those decisions, we're making that decision as a community and not in isolation. And so those are going to be tough. It's going to be a tough several months ahead of us. But it is also great news that we have a vaccine to distribute. So with that, I'd like to take some questions.
Hey there, can you hear me?
I can.
Grand. So one of the things I'm wondering about is when you have that many people in phase 1B, does it create this first come, first serve kind of scenario? Are there plans in place for getting the vaccine to people who are medically vulnerable, who aren't comfortable waiting in lines? Like, I'm thinking specifically folks at Reach Incorporated.
We're going to continue to try to avoid long lines and big crowds of people. I think there's a recognition across the state with local health departments for a lot of reasons. We don't want to have large numbers of people in lines in large numbers. And that adds to the complexity and adds to the challenge. The way that we have engineered our point of dispensing at the fairgrounds is appointment based. People can go online and make an appointment and then show up at their appointed time. And that really has cut down the number of lines. We've gotten some good reports on how that's working. And I want to acknowledge and give credit to the team that we have in our incident command who's made that work. We're going to continue to work that way in our pods. We're probably not going to be having pods where we just call people to the fairgrounds and have them line up and wait in line. We're going to be working through to make sure that they are able to sign up for a specified time. Currently, we're using the Schedulicity software to do that. We're planning, when it's available, to make a move to a new software system that the state is going to be making available to local health departments in order to be able to do that planning. But when we get to that point in time, we don't want people just showing up and having to wait for hours on end in confined areas or in long lines. We're going to be working on an appointment basis. That does a couple of things. One, it keeps people it helps us limit spread. It helps us keep people apart, and it also makes it more efficient. It makes it more time considerate for the people who are showing up to get those shots.
Hey, Catherine, this is Patrick Lonergan. I can maybe just add one quick thing to that. I think along the lines of what you asked, the vaccine distribution group that Matt mentioned that we've been working with, that's made up of representatives from across the spectrum of our community. That's part of what we're working with that group on, is to help identify out of this phase 1B group, who are the most vulnerable and who should we focus our effort on first? Because we can't do them all at once, and we can't accommodate them all at once. So that's part of that discussion with that group, is trying to figure out, well, who are the most vulnerable of that vulnerable group, and how do we reach out to them, and how do we get them in a sequential order that we can accommodate as our supplies arrive.
And I would imagine that'll be, thank you, Patrick. I would imagine that will be driven to a great extent by the state's plan. I know it's really important that as we move through this, especially at the outset, that we're working together. And so I think it'll be a lot of emphasis on age and a lot of emphasis on those pre-existing conditions, and working with our partners at Bozeman Health and community health partners to help us identify those folks and kind of break this up so that we are getting to the people who have the greatest impact for the health of our community. That's a work in progress. It's not a set plan, Catherine. It's something that we're building kind of as we go, and it's something the state is working on. As you can imagine, with a new governor, with a new protocol for how to do that, that is not work that's all done. That's work that we're doing together right now.
So one of the things that I had asked the governor yesterday about this, and he said it would likely be a first come, first served scenario. And I asked for clarification on that and haven't gotten it yet. But it sounds like Gallatin County does intend to also reach out to vulnerable groups and look at priorities within that priority. Is that fair?
Yeah, and I think we're working with the governor's team and with DPHHS to make sure they're going to be setting some guardrails around how counties do that, so there's some consistency. But what I'm hearing from the state is that there's a recognition that the counties are different. We have different populations, we have different population mixes, we have different size of population, we have different access points. And so they're going to give us some flexibility in how we do that within the context of the priority groups that the state has laid out. Other questions?
Hi, Nora Shelley with the Bozeman Daily Chronicle. I'm wondering, as we move into the next phases, how you expect people will be notified that they're eligible, and if there's been any challenges in the 1A phase with, getting in touch with healthcare workers and kind of getting all those people kind of clued into the process.
Well, it's all challenging. I mean, there's challenges all through this process. With the 1A folks, though, those challenges are alleviated by the fact that many of those people work with partners They work with organizations that are used to the healthcare system. They're used to administration. So that has made it a bit easier with 1A. As we move to 1B, it's going to be working with, probably working with healthcare providers to identify people who are most at risk, and then having them direct those folks to our appointment systems. We're also, as we do that, though, we have to keep in mind that there are some people who are operating outside of that system, and so that we're making sure that as we work with, healthcare providers that are in our community, that we're continuing to think through who we're missing that way, and making sure we're making pathways and we're doing outreach to accommodate them. So I think it's going to be a mix of us reaching out to healthcare providers to have them help us identify people who are most at risk and get them in for shots. Also be, I think, I'm very hopeful, and I think we're counting on healthcare providers getting a vaccine themselves and administering the vaccine, pharmacies administering the vaccine. So as we move through this, I'm hoping that we have a wider array of providers, and those healthcare providers know their patients, and that'll be helpful. But a lot of it is going to be about how much vaccine we have, and we're going to be reaching out to providers, and we're also going to be looking at ways where there's gaps and making sure that we're looking for opportunities. And adults with developmental disabilities is one example of that, to make sure that we're reaching out to the organizations that serve those people and make sure that they're being connected to the system and that we're getting them the shots when they're eligible for it.
Okay, and the other question I had was, when we get to the occupation-based phase for teachers or grocery store workers, how much do you expect employers to be involved in that process, if at all?
A lot. I mean, in trade groups, we're a ways away from that right now, Nora. I mean, as you would note, that the occupational groups kind of got moved into, I think, 1C. So we're really focused on that 1B group. Once we get there, I'm pretty certain that those trade groups, and the employers will be pretty important. Brady, did you have something?
Sure, yeah. I was just wondering if we had seen the more contagious strain of COVID-19 here, and what's being done to monitor that.
That's a good question for the state. I don't know the answer to it. I'm going to refer that to the state health department. I'm not aware of us finding the strain here in Montana. I'm not sure how that surveillance works at the state level, Freddie, to tell you the truth.
Hey, Matt. I am not sure if you mentioned this before. I may have missed it, but obviously you've been kind of getting your information on next vaccine shipments every now and then. So I was wondering if you guys knew yet if you were receiving a shipment next week, and if so, how many, so the health department can keep doing your pod at the fairgrounds for next week.
What do we know that we can say about that, Patrick?
We seem very confident that the health department believes that we will receive early next week a shipment of 500 doses. And that's the most recent information that we have.
Other questions?
Hi, I'm Megan Myskowski with Montana Public Radio, and I have a question about testing from private groups. How much is that contributing to the county's testing capacity and data collection efforts?
When you say testing from private groups, what are you referring to?
So for example, like Big Sky Relief.
Yeah. Well, and how much it's contributing to what?
To testing efforts in the state and the data collection of cases.
Well, that Big Sky Relief effort is really a standalone effort that is separate and distinct from the other surveillance, the other testing system that we have that's operating in the rest of the county. That group raised the money and essentially bought a lab and is running that testing. And that was something that was important to us, that whatever effort was being made there wasn't impacting the larger testing system. And so that it continues on. They're doing a significant number of tests. I think having that number of tests happening is helpful to identifying cases quickly and reducing the amount of spread. But that is happening in a fairly specific geographic area. it's notable that MSU announced and the university system announced, I think this week, that they're planning to do some surveillance testing on campus. I think it's impressive and noteworthy that they've been able to stand that up and are pushing forward with that. And I think that will help. It's a first step, and I think it's encouraging first step to help us continue to identify cases quickly. The testing system overall has become more diverse, and with that diversity, it becomes more complex. That's okay. I mean, that's what we don't want things to be static. We want to continue to people have that. It makes it harder. It makes it more complex to track it. It makes it more difficult to interpret some of our data, but that's okay. We do want to see more testing available, the same as we want to see more vaccine available. Other questions?
Hey, Matt, you mentioned, especially yesterday, and I found it really interesting too, and you just mentioned it again just a bit ago, with grocery store workers. And I know you've touched on this here and there throughout. Grocery store workers and teachers, trade skills have moved to 1C. What's the mindset with those changes with the health department? I know that's a recent change, and a few folks have questioned that in the past. What's the mindset with the health department, and how you guys preparing moving things around or anything like that?
You know, in thinking about this and thinking this through, what I'm trying to do is make sure that the community is aware that we don't have enough vaccine to go around, and all these decisions that we're making have trade-offs. But I do think at this point in time, it's really important that we work together with Governor Gianforte and his team. He was elected governor, and he's leading the state through this prioritization. And my intention is to do what I can to help the state make that work. And that's going to be continuing to work within the parameters that they've put forward. My intention and hope is to respect the governor's plan and do our level best to make it work. It's going to go better if we're all coordinated and collaborative on that. But I also think it's important that people understand we don't have enough vaccine to go around. And so these choices have trade-offs. It's completely reasonable and probably smart to think through and to be emphasizing people based on age and their health conditions. As we do that, we need to understand that those specific groups that also it's completely reasonable. And I think there's would be a lot of benefit to being able to get teachers vaccinated. But if we're going to get all teachers vaccinated, there would be a trade-off for that. So what we're going to be doing is working within I think the parameters that the governor has laid out. And we're looking at ways within the scope of that system to be able to make decisions for our community and get vaccine to people who it will most benefit. So that's our plan right now. We're really looking forward to working with the state to get this vaccine out in a cohesive, collaborative way.
Hi, my name is Caitlin Nicholas from Yellowstone Public Radio. Just given the governor's announcement of changes to the phases of vaccine rollout this week, how much of your vaccination plan needs to be reworked, and how long do you think that's going to take?
It's going to take weeks and months. We're going to continue to refine that plan. It's not like you get the plan done and then you go out and you execute it. In this environment, it's going to be continuously changing, and we're going to have to be flexible. And that's one of the things that our incident command team has continued to preach. We're going to have to continue to be flexible. I would imagine, just as we have a new governor, we're going to have a new president fairly soon, and there might be changes that are related to that new president coming in. We're going to have to continually be flexible with that. What I think is important is that we all keep listening to one another, that we all do our best to work with one another. And what we all need from the public is an understanding that the bottom line is we don't have enough vaccine to get it to everybody we would like to get it to right now. And we're doing our best to make sure to build the systems that when it does get here, we can get it to people, and we can do it in a way that's safe, that's timely, and that's transparent.
Given that lack of vaccine that is, every county is facing that situation, I think, do you have any idea how close Gallatin County is to completing phase 1A?
We're hoping to get, most of it done within the next week or two. The state set a goal or a projection, I guess, to be through phase 1A. Again, it's just a projection around January 15th. That feels fairly reasonable to us right now. It's important to understand, though, that once we move into 1B, that doesn't mean 1A is completely over. We'll keep giving shots to people who are eligible within that group, but we want to get to a point where we've at least offered it, and we've provided the opportunity for people in that group. And then, as the state makes the evaluation that most counties are getting to the point where they're ready to go, and we have the vaccine to do it, we want to be ready to move into 1B. I hope that happens this month. Again, I would really caution, I really want all of you to hear, there's a lot of people eligible in 1B. Not most of those people are not going to be able to get the vaccine in the first couple of weeks or even the first month that we have. We just don't have enough vaccine available. We are going to work hard to get it to the people who are most vulnerable, probably starting with the higher age groups and people who have really significant health conditions. But it's going to be challenging, and I know it's going to be at times contentious and probably frustrating for people at times. And we're hoping to take as much of that away as we can.
Hey, Matt, Noah Schmick with ABC Fox Montana, Wake Up Montana. I'm wondering, with these booster shots that are coming to the nursing home residents and the nursing homes within, the next couple of weeks, if you guys have any information, or if you've looked far enough ahead to look at that local emergency rule on nursing home visitations, if you guys are going to revisit that here soon.
Well, remember, our local emergency rule really is pretty much in line with the guidance from the Centers for Medicaid and Medicare Services, as well as the statewide rules. And we're trying to get, we're really trying to allow visitation where it's safe. We don't have a restriction on visitation that goes beyond, for nursing homes, what the Center for Medicaid and Medicare Services is allowing. We'll continually evaluate that, but remember, we don't have a rule now that says you can't go visit an assisted living facility or a nursing home, but it sets some parameters there. And I would imagine that we'll continue to evaluate that as we move forward. Absolutely, but we'll see what happens both at the federal level and the state level. And we'll also continue to talk to those providers at the local level to try and pull those things together.
I had another question. I was wondering, with getting second doses shipped in, if there's been any hiccups that you've been aware of with that.
Not that I'm aware of, but we haven't gotten there yet. We got our first allocation December 23rd. And so we're about a week or week and a half away from that second dose administration. I have not heard any problems with it.
Oops, sorry, you guys probably just heard all my typing. I forgot to remute myself. But one of the things I'm curious about, knowing that there's already not going to be enough vaccines for who is listed in group phase 1B, but the list of medical risks in that category, does that list cover the concerns you have for congregate care settings, given the fact that congregate care settings have moved into 1C?
I missed the middle part of that question, Catherine.
Yeah, sorry. I'm wondering if the list of medical conditions included in phase 1B covers your concerns for congregate care settings, given the fact that congregate care settings have moved down into 1C.
I think it's important to understand and recognize that what the new 1B says is not that we can't give shots in congregate settings. What it's saying is we should give shots to people who fall within the categories that are identified. So if we have somebody who's over the age of 70 or somebody who has those pre-existing conditions, that's where we're going to work in those congregate settings. Yeah, I'm still concerned. I think that some of those congregate settings are a concern. I do think that we're going to find ways to address that. I think especially with like adults with disabilities, those kinds of places, I think we're gonna do our best. I still think that's one of those trade-offs that you make when you go to the a prioritization that is more aligned with age and healthcare condition. You take out some of those other groups, and that it does cause concern. But frankly, any decision we make, any path we would go down, would cause concern in one way or another. So we're continually evaluating it, and that's why we have our stakeholder group that was pulled together, because we need sort of a diverse group of voices and people to help us make sure we're not forgetting anything, or we're doing our best not to forget about populations and gaps that we might have out there.
And what would be kind of the specific concerns, if there is a list of the medically vulnerable that you can go in and make sure that those folks in the facilities have vaccines? What would be the overhanging concern that you mentioned?
Well, I mean, when you have people living in congregate settings, spread is more likely. And so you have a higher risk in those settings. And so, to be able to go in to a setting like that and at least offer the vaccine to everybody across the board would be a powerful tool. But for every vaccine that you give in a setting like that, that's a vaccine you're probably taking away from somebody who's over the age of 70. And that's where we're seeing most of the mortality. And so, that's the concern, is that those settings are higher risk. But just know, like, we're going to be considering that as we think through how to apply the factors outlined by the governor in 1B. We're going to be combining that with knowledge we have locally about those congregate settings where we think there is risk, and reaching out to those organizations and those congregate settings to make sure that where there are people who fall into those categories, we're getting them shots when we can.
Thank you.
Yeah.
Hey, Matt, this is a little unrelated to vaccines, but are you finding that businesses are continuing to comply with the health rules?
For the most part, I mean, as we have seen throughout this, our experience is that businesses want to do what is best for their customers, their staff, and themselves. And so, yeah, we're seeing that the vast majority of businesses are working hard to help us find a way through the pandemic that is safe and healthy.
Have you sent out any more warning letters?
No, I don't think so. I think not that I'm aware of, Freddie. Other questions? All right, I appreciate all your time. I hope you have a good weekend, and we'll see you probably before next week at this time, but definitely next week at this time. Take care.
Thanks, Matt.
Thank you.
Thanks.
Thank you.